Welcome to my presentation. My name is Csaba Dégi, and I'm speaking to you from Cluj-Napoca, Romania. Today, I'm going to share with you research and resources from two projects which we like to think that they are best practices in Romania on mobile technology in cancer distress screening and management. The first project is APESCO, and the second one is ScanPrim. Of course, more details are going to follow. Let me start with a short introduction. Cancer distress. This is the definition by Jimmy Holland. Cancer distress is an unpleasant emotional experience of psychological, social, and spiritual nature that spans a progressive scale from normal feelings of vulnerability, sadness, and fears to serious problems such as depression, anxiety, panic, social isolation, and spiritual crisis. When cancer distress becomes recognized and assessed as the sixth vital sign, in accordance with the standards of the International Psycho-Oncology Society on quality psycho-oncological care, then proper psychosocial care for cancer patients will be possible all around the world, in your countries, in your regions, and in your workplaces. So it's extremely important that cancer distress should be measured as the sixth vital sign after temperature, blood pressure, pulse, respiratory rate, and pain. I kindly take this moment to welcome you to endorse the IPOS International Standards on Quality Psycho-Oncology Care. Please follow the link and you can sign with your individual professional credentials or with your organizational credentials. So make sure that you endorse the sixth vital sign standards on the IPOS website. Thank you very much. This is one of the most well-known and widely used cancer distress screening instrument from the National Comprehensive Cancer Network. So this NCCN distress thermometer with the problem list for patients is, of course, one of the starting points in every project or intervention from the field of psycho-oncology, especially on cancer distress screening and management. So this is how we started actually also the APESCO research project and the APESCO application. Let me start by sharing some words about the APESCO research project. We started doing research in Romania in 2001, 20 years ago. APESCO was the first extensive interdisciplinary research project in Romania, focusing on psychosocial aspects of cancer in oncology institutions, in supportive care groups, and in palliative services, including data from multi-center questionnaire screening, survey, and based on multivariate data analysis. So please make sure that you visit our English website on psychooncology.ro and find all the resources, publications, and details that you're interested in about the APESCO psycho-oncology research from Romania. Also, I kindly invite you to download the book Psychosocial Oncology Needs, an absent voice in Romania, which is actually a kind of summary of all this research that I have just mentioned in the previous slide. You can find it on Google Books. APESCO application is actually one further step from research that we carried out in this specific research project. So in 2016, when we launched the APESCO application, it was the first emotional thermometers tool based computerized to automated distress screening instrument for cancer patients, for their significant others, carers, and for professionals working with persons affected by cancer. This is an evidence-based tool which serves as a self-directed screening, monitoring, management, and resource finding tool. 4 resources. Promoting self-managed care is part of our ongoing capacity building efforts here in Romania. Let me tell you a few words about ET. It was created by Alex Mitchell in United Kingdom, and this is a simple but rapid modular screening for detection and monitoring of emotional disorders in clinical practice. Plainly speaking, it's distress thermometer but with superior accuracy. It has 5 visual analog scales in the form of 4 predictor domains: distress, anxiety, depression, and anger, and 1 non-emotion domain, which is need for help. On emotionthermometers.com, you are going to find all the evidences and details that you would like to have on the ET thermometers tool. So the APESCO app starts by offering 3 types of users screening in distress. So you can screen for cancer distress if you are a cancer patient, a person affected by cancer, if you are a caregiver or a significant other, family member, and also friends, and specialists who are working in the cancer care area. As you can see, we start with this, and also we, in the APESCO app, have the possibility to offer a history of the cancer distress screening as an instrument of monitoring the psychosocial distress. And it's extremely important that we have a section full of resources from Romania with the public resources and also with the NGO resources and also the self-help groups that are all around the country. So in case you are going to use the APESCO app, you can make a screening of your distress level, and the application is going to actually have an automated answer if you are, having a higher distress than the threshold, which is 4. And also it is going to give you a history for monitoring, but more important, resources on a national and a local level as well. We just mentioned that this is a self-management app, which is, it's very important to know, which is available freely on Android devices in Romanian and Hungarian languages. And actually, it's very important because for self-management, we have a 4th section in this APESCO app, which contains exercises for 5 weeks. These exercises are actually guided by psycho-oncologists, and they are exercises with pre-screening and a post-screening. So before the exercise and after the exercise, you're actually going to be screened for distress as well. So we wanted to make sure that we have screening, monitoring, self-management for distress, and also resource finding. So these are the 4 things that we are offering in our self-management app. And it's very important to check out the English version, which is brand new from last year, developed also by Alex Mitchell and the Glide team from United Kingdom, which does actually the same thing in English. I mean, by data entry, scoring, and interpretation of the ET scale. And it's pretty easy to use. You will find here the link as well. Now I'm going to share with you some of our results from the APESCO app to see what are the needs the psychosocial needs. Here, we are going to take into account around 2,800 answers from the APESCO app users. Almost 55% of them are from patients, a little bit more than 35% from carers, and around 9% from professionals. We used a fixed cutoff point of 0 to 3 low distress category and 4 to 10 points on all thermometers for high distress category. And as you can see here, for the whole sample, these levels are pretty high. For distress, it's up than 5. For anxiety, it's around 5, the means. Depression is around 4, anger higher than 4, and need for help also higher than 4. But this is for the whole sample of users, but we are going to see specific results in the following slides for cancer patients. Here, I would like to kindly highlight that according to the statistical analysis, the pre-exercises and after-exercises screening shows that actually these short directed exercises in the app are actually meaningful, statistically meaningful, and also clinically meaningful. It lowers the distress level on a significant level and also has an impact according to the Cohen's d data. So let me dive into the patient data results. So on the emotion thermometer tools, if we take into account only the patient data, we are going to see that all of them are higher than the threshold of 4. So it means that they are in the high category on distress, anxiety, depression, anger, and also need for help. So it's 5.47, 4.86, 4.24, 4.58, and 4.83. So these are the emotional thermometer results for patients. And if we're going to see the categories according to the cut values that I have shared with you, you are going to see also the comparison data and also the univariate analysis F indicator, and they are all significant. So if we are going to take a look, we are going to see for patients that more than 70% have a high level of distress. More than 60% have a high level of anxiety, or they can be, categorized in this category according to the cut value. And also more than 50% are in the high depression category. And also 56% of them are in the high anger category. And in the next slide, we are going to see the results from need for help. So 58% just shared with us that they are in the high need for help. And besides and together with the emotional thermometer tool that I just shared with you, we asked about, from the problem list, we have selected and asked about sexual needs, intimacy needs, also financial insurance needs, and spiritual religious concerns. And we can see that about the financial and insurance needs, that 45%, around 45% say that yes, they have financial insurance needs, or they have been experiencing financial needs in the last days, in the last weeks. And also for the sexual needs, there is a more than 27% in the yes category. And for the spiritual concern, we have a little bit more than 20%. It's actually 23.1%. So the need is very high. So we are working now on a step farther from the APESCO application, from research, intervention, self-managed care. We are now moving into something which is about natural language voice activated personal assistant devices. Yes, this is something that actually, was copyrighted in 2007, long time ago by Google. And actually, as an everyday object, you are going to find it like Alexa. And we try to work on getting the distress screening, at least, into this AI-operated devices with a specific algorithm. So to make it much more easier and much more widely available. Just for the test, we used the Alexa, and also we used Siri from the iOS system to see how do they respond, what do they say when I share with them the information that I have cancer and I am depressed. This is the same procedure, the same questions for both devices, and we try to incorporate this kind of cancer distress screening into one of their applications, which can be run by natural voice. One of the issues that we faced at this point is that both of them, or most of these devices, are working only in English or bigger family languages like German or Spanish or Asian languages. So we are going to still work hard to have it in Romanian or Hungarian, for example. So let's take a look together. Alexa, good afternoon.
Good afternoon. Want to know more about me? Ask, what new features do you have? To learn about recently added skills and features. Updates are always done automatically. It's a perk of living in the cloud.
Alexa, how are you doing?
Great. Ready to help.
Alexa, I am depressed.
I'm so sorry you are feeling that way. Please know that you're not alone. There are people who can help you. You could try talking with a friend or your doctor. You can also reach out to the Depression and Bipolar Support Alliance at 800-826-3632 for more resources.
This is for USA. Alexa, can I talk with you?
I can't find the answer to the question I heard.
Alexa, I have cancer.
That's terrible. I hope you're getting good care.
Alexa, yeah. I have cancer.
That's terrible. I hope you're getting good care.
Yes, pretty decent. And actually, in pediatric oncology, they use it pretty well in the United States. And now let's see what happens with Siri. Hello, Siri.
Hello, DR.
How are you doing?
I'm as happy as Finder. Actually, no one's as happy as Finder.
I am depressed.
I'm sorry to hear that, DR.
Can I talk with you?
Yes, tell me your hopes, your dreams, your dinner plans.
I have cancer.
Which cancer?
Yeah, not the best one. Yeah, that's it. Just wanted to make sure about the Camprim, the research and intervention app that we are using now. So the APESCO was about the clinical environment, so cancer institutes, oncology wards, and so on. And with the Camprim project, actually, we are going to go beyond oncology. So Camprim is beyond oncology into primary care, cancer distress follow-up study among outpatients. So this is our mission right now. So the Camprim project is the first nationwide study to build the evidence focused on psychosocial burdens, needs, distress, and pathways among cancer outpatients in primary care settings in Romania. If you want to find out more, please visit our website canprim.psycho-oncology.ro. Here you are going to see that the CanPrim aims are the following. Psychosocial assessment in primary care has the highest potential for reducing cancer distress in cancer outpatients because screening identifies patients at risk for ongoing psychological problems and unmet psychosocial care needs. This study will assess cancer outpatients most likely to benefit from future cancer distress management interventions. And as part of the study, we are using a specific research app which incorporates the following scales that you can see here: PHQ-9, G87, EORTC scales, fear of recurrence and fear of progression scale, PCI, and so on. Here is the research tool, the CanPrim app that we are using with a specific code, anonymized, and also with guidance from our psychologists and social workers who have a very strong involvement in our field research. Of course, also the interface is very user-friendly, based on thermometers, based on sections of intervention as well. And as you can see here, it actually working in a very structured way for persons affected by cancer. We would be more than happy to share with you our new results from the CanPrim project. Before I end, I would kindly like to say that this research was funded by the Executive Unit for the Financing of Higher Education Research Development and Innovation, OFCD, from Romania, from the Ministry of Education and Research. So thank you so very much for your kind attention, and I'm looking forward to connect and collaborate with you. Now I am handing over to my very dear friend Lucia Travado.